Facebook Live, Ask the Healthcare Advocate, where I try to answer all of your healthcare related questions in Israel and sometimes in general. And today is second in our series of disability in bituach leumi. So we're doing a deep dive series on bituach leumi, which is the Israel National Insurance Plan, and we're going to get specific on how to apply to disability. So, brief review. Obviously, you can find more on my website and on bituach leumi's website and on Kol Zchut. And if I don't answer your question here, obviously feel free to private message me or drop me an email, and I'd be happy to try to explain more to you. But here we go. We're going to do what you need to know about disability in bituach leumi. 1. Who is eligible? You are eligible to apply for any stipend from bituach leumi after you have been in Israel for a year, meaning after a year after Aliyah. There are some extenuating circumstances where you can apply to certain other things either 90 days or 6 months after, but just in general, 1 year after you make Aliyah, you are eligible to apply for disability if you are under retirement age, which is 62 for a woman and 67 for a man currently. You have 3 things. So 1 is the age, 2 is the medical criteria, meaning you have a medical condition that affects your daily functioning and prevents you from working or meeting your full work potential in some manner. And 3, there is a financial criteria, meaning you cannot earn more than X amount of money, meaning you cannot have a passive income of 25,000 shekels a month, let us say, or you are working full time, but you are saying that you are disabled and therefore not really able to work, because that is contradictory. So, to review, we have 1, at least a year after Aliyah. 2, you have to be under retirement age. 3, you have to have a medical issue that affects your life on a daily basis and prevents you from working your full potential. And 4, you can't have an excessive amount of passive or active income at your disposal. If you think that you might make that criteria, then you go online and you may apply online now to bituach leumi. You do not have to go in. There is an online form. You go onto their website. They have a lovely site in English, which is actually quite well organized. You go under forms and you're looking for general disability. This is if you are over 18. If you are applying for a child who is under 18, then you fill out the form on behalf of the child, and that is another form. But we're going to focus on adults right now. If you are an adult, you fill out the adult form and you fill in the information. This is what you will need. You will need a copy of your Teudat Zehut, or the Teudat itself, which shows you the date of issue of your Teudat Zehut, in addition to other general information, date of birth, marriage status, blah, blah. You will also need your bank account information, and you will need bank account information of anybody who is on or shares that bank account with you, including their Teudat Zehut. Now, you will also need to define what medical issues you have, so you have to categorize them, and then you have to bring enough medical evidence that demonstrates that you in fact have a significant enough deficit from this medical issue that is preventing you from doing your full work potential. So what does that mean? It means that if you have epilepsy, you need a letter from the specialist. It's not enough from the family doctor. You need a letter from the specialist, a neurologist in this case, who A, provides you with a diagnosis, B, explains how the epilepsy manifests itself in your life. Do you have seizures very rarely? Do you have them off and on? Do they last for a long time? Are they well regulated with the medication or not? And if you have any complications from this seizure, for example, you cannot work for 2 days afterwards, or your cognitive functioning is effective, etc. So, important things to remember for this. 1, you always need a letter from a specialist. Having a letter from a family doctor is not enough. 2, you need a letter from an Israeli specialist. Having a letter from an American specialist is not enough. You can bring that information to the Israeli specialist to explain to them maybe testing or diagnoses that you had in the past, and let them, as I call it, translate it into Israeli, not only language, but terms and usage and ways of presenting it that are appropriate for the Israeli system. 3, it needs to have been within the 6 months to year previous to the application. If it's older than that, it's not really going to help you. You need to bring as many experts as you can to demonstrate that situation. For example, if you have Parkinson's, even the beginning, you can see a neurologist. You might have, I guess not, an orthopedist wouldn't necessarily be right. So it would be a neurologist. There are some issues that will lend themselves to having several experts weigh in. You should bring them both, those letters. If you have been hospitalized within the past year, you need to submit a letter of discharge from the hospital. And if you don't have a copy of that, you can contact the hospital directly. You get to the archives department. They're only open during the day, usually till 3. And you can ask them to send you a copy of the discharge. Sometimes you have to pay 20 shekels. Sometimes you actually have to go down to the hospital and request it. But it could be with Corona that they're a bit more flexible. And any imaging that you have done in the past year, CT, X-ray, endoscopy, MRI, etc. You want not the disc itself, but the fa'anuach, meaning the letter that explains what it was that the doctor saw. You are going to upload all of that information. Plus, you are going to have to sign a form which you download, print, sign, and upload again, which says that you agree for your medical information to be seen by bituach leumi office, and they can reach out to whomever they want. And then you submit. It usually takes them only a couple of weeks to get back to you. They become much, much more efficient. Sometimes they'll get back to you because they need more medical evidence or they want a piece of paper, etc., etc. And if they don't need anything, then they will get back to you to set a date for your va'ada refu'it, which is your medical committee where you will speak to whatever specialist is connected to your issue. They will discuss it with you. It's usually a short meeting, and then they will determine your level of disability. Now, 2 things to remember about that. One is that if you have multiple issues that you have submitted, let's say I have a neurology issue, an orthopedic issue, and a gastro issue, then they will usually assign you to 3 different meetings, meaning you'll speak with a neurologist, the orthopedist, and an internist. And it's not always on the same day, so just be aware of that. You bring all the papers with you that you submitted to. It's always good to have, and anything new that might have arisen between the time you applied and the time that you have your committee. And that is, in a nutshell, how we apply to bituach leumi disability. So feel free to share your own stories or your own questions in the comments below. Happy to answer any specific questions about that. If you've got a more complicated case, please feel free to write me. In the instances where you feel that you need help with the Hebrew or putting things together, this is also a service that Health Advice provides, so feel free to contact us about that. And please join us every Sunday as we discuss another issue in the healthcare advocacy world. And please join us.